pandemic grows. Drive-through testing rolls out in a New York community, and more businesses shut down to contain the spread. Next on PBS NewsHour Weekend.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wachenheim III, the Cheryl and Philip Milstein family, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments.
When it comes to wireless, Consumer Cellular gives its customers the choice. Our no-contract plans give you as much or as little talk, text, and data as you want. And our U.S.-based customer service team is on hand to help. To learn more, go to consumercellular.tv.
Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you. From the Tisch WNET studios at Lincoln Center in New York, Hari Srinivasan.
Good evening and thanks for joining us. The spread of the novel coronavirus caused the United States to restrict travel from the United Kingdom and Ireland beginning Monday at midnight. And the president said today that he has been tested for the virus but does not have results yet.
I also took the test last night, and I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
Mr. Trump also said he had his temperature taken today before the briefing, as did all who were there, and that it was totally normal.
Gentlewoman yields back.
Early this morning, the House of Representatives passed a bill with bipartisan support that includes access to paid leave, Medicaid, unemployment insurance, and food assistance programs for people and families quarantined or diagnosed with the virus. The legislation also guarantees free testing for the virus. The bill still has to pass the Senate. President Trump tweeted last night he fully supports the bill. Confirmed cases in the U.S. continue to rise today, with more than 2,200 now reported, many in the hot spots in the states of Washington, California, and New York. In the city of New Rochelle, just north of New York City, mandatory restrictions are in place, and new testing began yesterday. NewsHour Weekend's Christopher Booker has the latest.
In a commandeered county park, New York State's first drive-through testing site for novel coronavirus is fully operational. Governor Andrew Cuomo says the site can process up to 200 tests a day.
There are 6 lanes that are operating. You drive in your car, and the medical staff comes to you, does the test, takes the swabs, and then you pull out. The swabs get sent to a laboratory. They do the testing. We get the results back to the person.
The mobile testing center will serve all residents of Westchester County, but officials are prioritizing people in New Rochelle, the town where it's located. It's one of America's hotspots for COVID-19. Most of the city's cases originated from Young Israel Synagogue of New Rochelle. Earlier this week, it was made the center of a, quote, containment area by the state of New York. For 2 weeks, for 1 mile in every direction, large gatherings would be banned. That meant closing schools, local colleges, and community centers, as well as religious institutions. The state's National Guard would also be deployed.
It's a sensible means of controlling the spread of the virus in an area where it has a high concentration, but it's not an exclusion zone, it's not a quarantine zone. No one is prevented from entering or leaving.
Noam Branson is the mayor of New Rochelle. He says the state National Guard's role in the containment area is limited.
The Guard is here in New Rochelle to provide logistical and operational support, principally delivering meals to students who cannot receive them at the public schools, providing supplies, providing cleaning services to large facilities. These are things that will be entirely beyond the capacity of a municipality the size of New Rochelle, so we're grateful to have their support. But they're not here in a military or policing function, and I think it's very important to draw that distinction.
But while there are no prohibitions on coming and going from the containment area, its designation has already had a significant impact on local businesses.
I mean, this is like a ghost town now. This is really slow, people are scared.
Daniel Matoya is co-owner of Chicken Joe's. It's about a mile from the synagogue and right on the edge of the containment area. He says his takeout spot is usually filled with customers, most of them from the nearby high school and Iona College, which is located right across the street. The college's administration canceled all in-person classes until April 10th. Matoya says he's already cut back on his workforce.
I sent 2 people out to the home. I mean, there's no business. We're really slow. But what else I can do? I mean, I'm trying to keep the business open as long as I can.
Like many around the country, people here are stocking up on food and other essentials or staying home. At the ShopRite in New Rochelle, Carolina Morales says she's nervous for her grandchildren, 3 of whom live with her, whose schools in nearby Mamaroneck are closed for at least 2 weeks.
I buy all the frozen foods because we can keep it for longer. We buy rice, bread, and all the stuff, cleaning stuff. We're scared, for the kids, and we don't know. We have to prepare.
Mayor Noam Bramson says the city is getting the support that it needs from the county and state government. And while he acknowledges that New Rochelle is still in the midst of the crisis, he hopes other cities can learn from the approach that New Rochelle has taken.
We're earlier than other cities, but many, many others will face circumstances similar to ours. And if we can serve as a positive example for how a community can come together and confront this challenge in an intelligent and calm and measured way, then we will have done a service.
Chris, I know the mobile testing center has only been open since yesterday, but how many tests have they been able to administer?
We were told that yesterday 150 cars came through the mobile center, but we don't know how many tests were performed. Earlier today, the governor did say they anticipate performing up to 200 tests today and up to 500 tests a day in coming days.
How does it work? I mean, does anybody from the entire county, do they just drive up there?
No, it's not like a fast food drive-through. You have to have an appointment. And the way this happens is you call the New York Health Department. And if you meet certain criteria, you're showing symptoms, you've been in contact with someone who has a confirmed case, or you recently traveled to one of the hotspots, then you might be able to get an appointment. Hari?
This is just one facility. It is in New Rochelle. What about the rest of the state? The state's one of the big epicenters of a lot of cases for the country.
Well, just yesterday, the state did receive FDA approval to have 28 labs perform manual tests. The governor says they anticipate this will increase the number of tests dramatically, going up to 6,000 tests a day. So far, they've only performed 3,000 tests in total.
Chris, we have any idea how the virus is spreading in New York?
Right now, what we know, and this will certainly change, is that there are over 500 confirmed cases in New York State, the majority of which are in New York City. And just this morning, New York State reported its first death. An 82-year-old woman in New York City who had been suffering from emphysema did indeed die from the coronavirus.
Christopher Brooker joining us from New Rochelle tonight. Thanks so much.
Thank you.
For more information on coronavirus, go to pbs.org/newshour. Italy remains on lockdown as officials and healthcare workers struggle to contain the coronavirus pandemic. Special correspondent Christopher Livesay joins us now via Skype from Rome. Chris, we had a conversation a week ago. What's changed?
Well, the lockdown that was previously limited to northern Italy, the hot spot here in this country, it expanded to cover the entire country. So that means as far south as Sicily and including the capital in Rome, where I am. And then in the past couple of days, they've actually heightened those restrictions. And so you're only supposed to go out if it's absolutely necessary, if you need to go to the hospital, if you need to get food. And that means that the types of services you'll find once you do go out are also limited. It means that cafes and clothing stores, they're all closed now as part of this ban in place. Pharmacies you will find open. Grocery stores you will find open, but if you want to actually be outside of your home, you have to have proof that it's a good reason. So that means carrying with you this self-minted affidavit in which you explain your business. And if you don't have this on you and the police stop you, you can be fined or even arrested. And by last count, about 5,000 Italians had already been charged for breaking these rules that are in place.
In a way, you are kind of speaking from the future of something that the United States might face, at least in terms of how this disease or this virus progresses.
What we know about this disease is that even if you're healthy, you can be a carrier for this disease. So even if you don't feel any of the symptoms, that doesn't mean you can't pass it on to your parents or your grandparents. And I'm sure that if a lot of people could go back in time and take greater precautions, they would. I mean, we're talking about a very serious situation, especially in northern Italy, where hospitals are failing, where they're having to triage patients because there are limited resources. When people come into the hospital and they're suffering respiratory failure, they have to be put on ventilators, and these are limited resources. A ventilator can cost tens of thousands of euros, and you have to be on these devices for 6 to 8 days at times. And if you're in your 80s, your chance of recovery is very low. So at a lot of hospitals, it's become a wartime situation in which doctors have to decide whether to give it to the 80-year-old or whether to give it to the 50-year-old or the 30-year-old. I mean, there are reports now of the dead not being able to be collected from their homes because the health services are overwhelmed, and you can't get a funeral home that's willing to risk going inside a house where there's coronavirus because they don't want to get infected. I mean, it conjures up images from the Middle Ages when you had the Black Death sweeping through this exact same place where I'm talking to you from.
You know, one of the things that I have seen online this week is also some of that pent-up frustrations of the Italians standing at their balconies trying to start singing and saying, you know, this is not going to defeat our spirit. Is this happening in different cities around the country? Is it something that was an anomaly?
It was, it's sort of like a flash mob, and it's something that I participated in myself just yesterday. My wife and I, we went out on our terrace, and we, at 6 o'clock in the evening with all of our neighbors, we sang the Italian national anthem. And there were some people with instruments playing guitar, some people, you know, banging on a drum, some just hitting their pots and pans in this show of unity. I mean, it's people are looking for reasons to show solidarity, and there are some bright spots here in the north, in certain towns that were on lockdown earlier than the rest of the country. They are starting to show signs of bouncing back, where the rate of contagion has been slowed. So there's hope that by taking such drastic measures throughout the entire country, that it won't get as bad, specifically because so far, as I mentioned, the worst cases have been in northern Italy. That changes the further south you go. And if this disease spreads south of Rome, or they just don't have the same resources, then we're going to look at an ugly situation getting a lot worse.
All right, Christopher Livesay joining us via Skype from Rome tonight. Thanks so much.
Thank you, Hari.
The response to the coronavirus outbreak is changing on an almost hourly basis. Testing is increasing, healthcare workers are facing new challenges, and there are guidelines for all of us to consider in our interactions. Caroline Chen, who reports on healthcare and public health issues for ProPublica, joins us now for more. One of the concerns that so many people have had now, last weekend, the administration said there's going to be 1 million more tests out there, test kits out there. They're going to be getting out to the private labs. They're going to be having access to it. And just this afternoon, we heard both the vice president and the president sort of modify that, because it seems like when you talk to doctors and hospitals, they don't necessarily have all those kits.
So things are literally changing hour by hour. I think even as of this week, we have continued to hear Americans say, we want to be tested, we can't get tested, and to hear doctors saying, we want to get these patients tested and we can't. And that's tremendously frustrating and anxiety provoking. And I think it's important not just on the individual level because of that anxiety of, you know, I want to know. It's important for the country to know where the disease is. And I keep thinking about an interview I did with a scientist who said the disease is ahead of the data. And that's so important because if you don't know where the disease has spread, it's so hard for public health officials to plan and to know how to respond at a macro scale. And I think the problem there, as we know, has not only been just production of the materials, but I think another thing that a lot of people just don't think about is, you know, it actually takes manpower at individual labs to run the tests. And so that's why continually been encouraging people to think about the idea of what is the capacity at your local lab? Now, as we just said, things are changing. So now we have these big commercial companies coming on board. So Quest and LabCorp came on board this week, and then on the horizon, which is great, Roche, which is a big Swiss pharmaceutical company and diagnostics company, just got FDA approval, and Thermo Fisher, which is another huge company. So that's going to be big volume, and that's great. I just wish those had been ready to go a month ago.
Right, that's one of the concerns that people have is, okay, that's fine 3 weeks out, 4 weeks out if we have these millions of tests, but what does the virus do in the meantime?
Well, the virus is not waiting.
Right. So is it, in these 3 or 4 weeks, should we just sort of default to that notion that, hey, listen, if you're presenting with these symptoms, call your doctor, don't show up at a waiting room right away?
So I think the recommendation has very clearly been to call and don't rush into a waiting room or to an ER, because really the hospitals need to be able to triage. So I would say, like, listen to whatever's being told to you in your area, but the advice is really pick up the phone first.
If our health is the first priority, then we want to make sure that the healthcare system has 10 weeks, 3 months, 6 months to be able to deal with all the people who might get sick.
Right.
But that also means 10 weeks, 3 months, 6 months that we are going to be taking these significant precautions and life changes.
Yeah, absolutely. And I think the thing that I feel like is a big take home from that notion of flattening the curve is that we all have a part to play here, right? That it's not this sort of inevitable thing that, you know, individuals have nothing that they can contribute to. So every action that you take, you know, staying home when you are sick, you know, making the choice to practice more social distancing, to, you know, not be, you know, in someone's face, you know, contributes to flattening the curve. And I think that we all can play a part there.
You know, there's sort of these conversations that happen among white-collar workers about working from home, but there's a lot of people in the country that don't have a choice. Their job includes being in front of other people and servicing them. We were talking offline about a phone call that you were getting from somebody who tell us about that.
Yeah, so I got a phone call that has really stuck with me from someone who works in a grocery store in the Seattle area, and this person told me that they're fairly elderly and they rely on this job, so they need this job to work, and they are now surrounded by people who are, you know, crowding in the store, panic shopping, and they can't afford to just not work the job. You know, they don't have a lot of paid time off. And the person who called me said, you know, I would love to just go home and quarantine myself and be safe, but I have to be at work. I need this job. And they just felt like they were waiting to be infected. And my heart just really went out to this person who called me because they had no choice.
Right, Caroline Chen from ProPublica, thanks so much for joining us.
Thank you for having me. And there are going to be other places that may have more capacity.
For my full conversation with Caroline Chen, visit facebook.com/newshour. The economic fallout from the new coronavirus outbreak is worldwide and may continue for months. Joining us now via Skype is the U.S. business editor for The Economist, Vijay Vaidheeswaran. You know, our first priority is obviously to think about the health stories and what's happening on the ground. But then when we see the impacts, when the businesses start to close, when the airplanes are flying less, there's a ripple effect here. How are we going to feel this?
This is an unprecedented crisis because it's a double whammy. We have both supply and demand hit at the same time, which was not, for example, the case with the global financial crisis. And at the same time as the health crisis is unfolding, we also have had an oil shock, a global oil shock. And so this is posing unusual challenges for governments as we respond. In terms of likely implications, I have bad news and good news. The bad news is the markets are obviously in deep distress. We can see from the financial markets and stocks. This is going to affect the real economy in terms of companies, especially small and medium businesses. We're headed for a cash crunch. JP Morgan is already calling a recession, 2 quarters of declines in economic growth. So that's the bad news. But the good news is it may be a brief recession, if indeed that's what happens, maybe just 2 quarters with a little impact on employment, and maybe even a bounce back, a sharp bounce back when demand rebounds, if government responds aggressively.
This last week, the Fed which the president criticized at great length today. The Fed tried to say, hey, we're going to inject another $1.5 trillion into this and make it easier for banks to lend with each other. We're going to keep decreasing these rates. Didn't seem to matter to Wall Street.
Again, this is an unusual kind of crisis because we haven't had this kind of a health crisis, which is what it is primarily. Let's remember the great tragedy are the human victims and the uncertain rates of fatality and transmission that we're dealing with, right? That's really where the source of this crisis comes from, and that we mustn't lose perspective. For that reason, the right first response is to help the first responders, meaning people on the front lines of healthcare. In America, we've unfortunately given inadequate resources to our frontline responders. That's being remedied quickly. We're a bit late to the party, but we can see now, both through the declaration of national emergency, but as well mobilization of resources to hospitals, getting more resources to them. That's the right thing to do. But the second kind of response, you talked about what can government do. The Fed cutting interest rates isn't going to make your supply chain deliver your parts to a widget maker in Ohio any quicker, right? And rates are almost at zero anyway. In Europe, they are zero and below, in Japan as well. So the tools available to central banks are not adequate to the task when it comes to the kind of stimulus we might have expected. Nevertheless, there are a couple of things government can and should do. One is we talked about companies running out of cash. That's the number one concern in the next 6 months. We can encourage banks, for example, not to call in loans. It's not like in China where the government controls the banks. They've already told the banks don't call in loans. But we have done this before where government can extend credit and encourage, and the Fed has done this to its credit in the last couple of days, encouraged bankers not to call in loans, to show forbearance. And I think that sort of talking up of good corporate citizenship is important, as well as providing credit. And I think that we've seen this after Hurricane Katrina. We saw that as well during the global financial crisis. But there's something else, and that is we need people to come forward who are sick. That's the number one thing we can do in terms of helping deal with the spread. If you're uninsured, as nearly 30 million Americans are, if you have little or unreliable sick pay, are you likely to come forward? And the answer is maybe not. And so we need to be much more forthright in saying government has to step in to provide payments to individuals and families that are doing the right thing.
All right, U.S. business editor of The Economist, Vijay Vaidheeswaran, joining us via Skype tonight. Thanks so much.
Thanks for having me.
Today, Spain joined Italy, becoming the second European country to declare a national shutdown. And in France, the government asked cafes, restaurants, and non-essential services to close. We'll have the latest on coronavirus and more expert analysis on tomorrow's broadcast. That's all for this edition of PBS NewsHour Weekend. I'm Hari Srinivasan. Thanks for watching. Have a good night.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wachenheim III, the Cheryl and Philip Milstein family, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments. Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.